Good morning, everyone. We're about to kick off our webinar. Karl, I'm just going to check that your sound is working before I do the introductions. Yeah, just testing. Does that look like a possibly no? No, that's fine. We're ready to go. All right.
So we've got 22 seconds.
22 seconds.
We'll start right on 10:30.
Yeah, that's counting up.
Okay.
Okay. All right. Well, welcome everyone. It's always a little strange hosting a webinar because we're so used to Zoom and seeing your faces, so it's slightly less interactive, but there is a chat function on this webinar, so please feel free to ask any questions and we'll address them as we go. My name's Liz Colliers and I'm Head of Communications here at VidVersity in the Sydney office, and joined in person today by VidVersity co-founder Natalie Wieland. So we're really excited to be together for the first time.
Even though we don't look like that's a dividing wall. We are sitting next to each other in Sydney.
That's right.
As someone from Melbourne, I'm very excited to be in Sydney.
And joining us today is Karl Moon from Uniting AgeWell from the Learning and Development team. And we're just so excited to have Karl with us today because we've been working closely over the past year, and we really are big fans of sharing success stories in online learning, as well as learning and development generally, because I think there is, obviously COVID has sort of become year zero for this world of creating and delivering learning, and we've had an enormous learning curve over that period, and there's been, I guess, lots of positives to come out of that and how we continue delivery of learning going forward, but no greater challenges have been experienced than those in the aged care sector, and Karl is here to share some of that, those incredible stories of what they've done and what they're going to take into the future. So I'm going to throw over now to Nat and Karl to sort of take us through those stories, because it's an informal chat and we don't have a lot of time, but there's lots to cover. So thank you.
Thanks. So I'll be very quick, Karl. So I met Karl last year, sort of just at the start of COVID, and I thought if you could just sort of tell them about what environment I came to and what problem we was trying to solve, where you were stuck as a result of the changes with COVID.
Yeah, sure. So hi, thanks for having me on for a chat. So I've worked at Uniting AgeWell for many years in the learning and development space, and we're a large aged care not-for-profit provider over Victoria and Tasmania, and we have over 3,000 staff in our organisation. We obviously are over different sort of environments, sort of retirement living, home care, also several residential services, and obviously we were sort of, when we started working together, Nat, we had been in an environment where we were meant to be changing learning management systems, and we had sort of been downspacing where we were working with that existing learning management system, ready to move to a new one, and COVID hit. And we had got rid of a instructional designer, and then we were sort of thought, oh God, what are we going to do? With COVID, we had a lot of new education and messaging really needed to get to staff really quickly. And obviously because of our services being locked down and our L&D team not being able to get to people for a face-to-face delivery, and it really difficult for us to develop training in our existing LMS quickly, we're at a lost space. So we started to talk with you about how we could use VidVersity to do that really quickly. And you really saved us in being able to do that.
And when I spoke to you, I suggested video as a way to really go fast. And you were very skeptical that you would be able to get that out securely and quickly and to your workforce, because they're very diverse and they're not like a corporate world where they're sitting at a laptop and we can just send them stuff. So the way we overcame that is we created videos and sent them to the phones, and that was a really effective way to do the training, wasn't it?
Yeah, I think there are a lot of things to overcome in our organisation. I think our organisation was pretty archaic in terms of their embracement of IT. And so we sort of had them in a chokehold a bit during COVID, which was great. We used that to our advantage and said, get with the program and come into the 21st century now, and they did that with some speed, which was great. We knew we needed to be quick and accessible with what we wanted to achieve, and VidVersity really did that. There was a whole lot of reluctance about whether video would work, whether people would do it, whether it was too quick and dirty, but we just ran with it because we knew we could, with your programs, we could get something out in a couple of days, and we did that. So we first started with what are the changes in our industry with COVID-19 right now? And there were heaps of them in aged care that were coming at us really quickly, and we needed our staff to know those right, on that day, straight away. And they were changes that some of them were informative and some of them required education. And so we were able to get them out using our people and our services. So videoing our staff doing those changes, whether it was a staff declaration entering one of our services, whether it was ensuring that hand hygiene was being completed, whether it was donning and doffing of PPE, ensuring people were using the appropriate process and practice. All of those things, we used our people at our sites doing those things. We then implemented a quick and dirty question and answer sort of process to ensure that people had watched the program, had understood the program, and then got those out to people. Initially, all we were concerned about that we had hits, so that we saw how many people had seen those programs, and we got them to people on their phones. So we weren't really that concerned initially when we were wanting to connect with people, whether they had who had done it and had they passed that. So we weren't really concerned about a compliance-based model. And initially we were saying, oh, wow, people are getting these on their phones. This is really accessible. People are really connected rather than them having to log on to their work-based computer. Remembering in our workplace, 80+% of our staff are personal care workers who probably don't have much connection to a computer-based sort of work environment. We were getting 2,000, 3,000 plus hits, within 2 or 3 days of us putting out these models. Then as time enabled, we sort of worked to getting much more of a compliance-based model, to then swarming those programs and putting them in our LMS so we could connect to who had completed them and were they compliant in understanding the information.
So let's go through the process of something. So I was working with you guys when we were doing the hand hygiene. Yeah. And so I thought if we could just go through the process of what we actually did. So you and I would sit down, or that your team would sit down on a Monday and say hand hygiene has become an issue.
Yeah.
And then what did you do to get to, within 3 or 4 days, you had a module ready to deliver? So what was the process?
So with hand hygiene, obviously, for most people listening, they would understand that that's, primary defence in aged care or in any health environment in relation to infection prevention control. So we would think about it, would go to as many work environments as we could, whether it be people working on the road, people in our corporate office, people in a residential service, and think about all the staff that we could be a part of that filming process. Excuse me. Administrators, cleaners, hotel service staff, registered nurses, management, personal carers, etc. Even if we could get some customers involved in that process and get them, film them doing, appropriate good technique of either using sanitizer or washing their hands with soap and water. And then what we would do is...
Can I just interrupt you? How did you film them? Was it a film crew?
No. The good old memories of iPhone. Yeah, and we just got used to people, saying, initially there was reluctance, but obviously for us as corporate or support staff, our world had changed as well. So we were not working our city office was closed. We weren't working there. We'd all sort of moved to working either from home or at one of our sites. So a lot of our staff were working at, a residential service. So it was, use your connections, talk to the people that you know and say, please, will you be in this video? It's great. So, and, using our iPhones and then uploading it via the VidVersity app, because we all probably know, or if you don't know, the video is incredibly large to send, but the VidVersity app makes it really easy to upload the video footage. And so I would get everyone in my team filming, getting the approval of the staff, uploading it, and then we would edit it with your help and knowledge, learning the program, how we edit that, how we can add some annotation, how we can add some music to the background of that, how we can then add some quiz questions at the end if we want to, and make a real package of that, and really quickly.
So this is sometimes the conversation would be on a Monday and it would be delivered maybe on a Wednesday to 3,000 people. Yeah. And the other thing that was interesting was when we were working through that was different languages spoken throughout the business.
Right.
So how did video help with that?
Well, it really helped with that, because what we really worked out was that historically for years we have been purchasing a lot of our mandatory or compulsory training, which would show, a 20 or 30-minute, really highly polished sort of, video-based program, and then people would have a fairly comprehensive type of assessment to complete. But it was, really long-winded, and we didn't really. We knew that people, I guess, did that in their own environment, either at work or at home. What we worked out that when we were developing these programs for people quickly, and that they were short and accessible, we knew that we were engaging people from obviously different ethnic backgrounds, English as a second language, a lot of them. They were included in the filming. We were able to put, a lot of script and text in the video, and it was easy for them. They got it, and people really enjoyed just quickly getting the information. They didn't need to be told something, over a half an hour period of time that they actually had previously heard the information before. They got it in a simple way.
And one of the things, so you actually recorded people in different languages.
Yeah, that's right.
I thought was really, really innovative and remarkable. One of the other things that I think has been really exciting to watch what you're doing. So sometimes it's about getting a subject matter expert in your business and talking about something. So for instance, say, I know we've chatted about this bullying and harassment training.
Yeah.
Now, if you buy that off the shelf, even if it's for aged care or health, every organisation has its own nuances. And I think we've spoken about you're 85% female, so sexual harassment isn't traditionally a huge part of what the education piece needs to be.
Sure.
So by having people in your own organisation, has that sort of increased engagement, do you think?
Absolutely. So, I think for a long time, particularly in face-to-face training or in our corporate training environment, often it's been really hard to get the subject matter experts, for example, the GM of people and culture there to do that training face-to-face or deliver that training. But using VidVersity, I've been able to have this sort of interview discussion like you and I are having now, side by side in Zoom, take that, really pull out those nuances that are relevant to the legislation, like, for example, in bullying and harassment, with the GM of people and culture. So, for example, us, it might be around exclusion in the workplace, or it might be around sometimes it might be around workplace directives that are not bullying behaviours was one that we really talked about. Being asked to work in a different ward environment on the day that you haven't been rostered to, but it's obviously needed because of the needs of the customers on that particular day, and that's obviously not bullying behaviour, but it's an appropriate workplace directive. So something like that, we can actually talk about that, talk about the industrial nature of that sort of comment. Those sorts of things are really great to be able to do from an L&D perspective. I can book those out with the subject matter experts from my organisation and really clearly develop that in the VidVersity context, as opposed to having to ask them to do it in a different environment.
Yeah, so actually I suspect moving forward in the workplace we're going to do a lot more of that. So to have the GM be the face of that on the training is so authentic and makes it really resonate with people. They say, oh, that's what we've got to do in our organisation. It's not just a generic training on bullying and harassment. Like I was telling you, a few years ago, I did some training at a large university where I work, and a big portion of the OH&S training was about forklift driving. And I found that very boring because I'm never going to drive a forklift, I don't think. So it's really great to be able to create really authentic, great content. But a really big piece of this puzzle from the design perspective is it's not enough just to create a video and dump it out there. You've been using the platform to add additional things, haven't you?
Yeah. So I guess, when I think about I guess sort of like we've thought about how VidVersity worked for us in an educational context, and really, it's really aligned, I guess, very succinctly with COVID occurring, and then I guess as the heat burned off with COVID, which there's always something else going on in aged care. It's very obviously legislative compliance driven, and there's always some changes. So there's always some other sort of L&D requirement to come up with. But we've also used VidVersity for not necessarily L&D requirements. So, for example, we've created some videos for things like Harmony Day, which was obviously a people and culture sort of celebration, really, and I guess we've had people from our organisation express what diversity means to them, and captured that with the diversity. We've also, I guess, thinking more about how that compliance-driven information can be captured. So now working with how we can, we have progressed with that LMS implementation in the organisation, and seeing how VidVersity will work in terms of SCORM compliance and capturing that data further in our LMS.
Yeah, so you've been doing things like if there's a bullying and harassment policy, you might pop that up on the screen and link to it. You've been writing some scenarios where people, so it's not just video, and it's very chapter based, so it's not watch this 2 hours and all the best. It's really about making the learner engaged. One of the things I wanted to ask is, do you know where people are mainly watching these videos?
Yeah, from what platform you mean?
Yeah.
Yeah, I definitely think it's from their mobile device. Yeah, and I think historically in our organisation we sort of really missed the mark with our LMS that we currently have, which we are soon to leave. It was very difficult for people to access that from home, and certainly impossible for people to access that from a mobile device. And I think that our organisation really misunderstood that people's willingness to access work-based learning in their own time on their own device. And what we have seen through this short 12-month implementation of VidVersity is that people are very willing to do that. But the learning has been short and the information has been succinct. And I think what has been really beneficial in that is that people have been really, really encouraged by seeing their own people, their own sites, and you know, that there's not necessarily a need to have, if you've got the subject matter experts in your organisation or you've got the material, you know how to do it, why not use your own places and your own people to put that new information together and present it? Because I think your workers are really chuffed with that innovation.
Yeah. I think, it's an interesting perspective, because I think it's not just the expertise that's in your organisation, but also the point of view. And I think something like Harmony Day is a good example where, just getting the perspective of people from different ethnic backgrounds within their workplace that they might not be able to express day to day. And I think it creates a lovely feeling of inclusion and, it just opens everyone's eyes. So I think it must be great for people to be able to do that as well.
Yeah, and one of the other problems we solved, you didn't have any technical issues. People were able to watch the videos because it's hosted in our platform. So your bandwidth couldn't accommodate video. That was the big issue, wasn't it?
Yeah, and I think also it just I think, like, historically in our organisation, a change like this would have taken a really long time, unfortunately. And I think for us, the timing was great because we didn't allow for a lot of, a lot of questions and a lot of timing. We just went, look, really got to get this out. People are stuck at their sites. So it was a great timing opportunity. The other messaging example was, there was a time where we thought during the pandemic or during the lockdown for us, where people may have been getting complacent with, the staffing declarations. There was a time where we were asking people to come, bring their uniforms to work and get changed at work. Hand hygiene was, incredibly rigorous for staff. And we thought about this, this tagline of being safe at home and safe at work. And, reference to what you said earlier, Nat, we asked all of our people from other, non-English speaking ethnicities to use that tagline in their language, say that tag in their language. And, I think we just really, that messaging was really good, because I think what we thought about our staff during COVID was, most people are, most people that work in aged care are coming to work because they really do care for the vulnerable, the residents or the customers that they look after, really important to them. But ultimately, during COVID, people were really concerned about their families at home as well. And so that I think that program that we did, Safe at Work equals Safe at Home, worked really well as well. Kept everyone on their toes, just managing all of that new information that they've been using.
And as an L&D department, you must have felt empowered that you could get messages really quickly and continue. I mean, serious incident training, that program's coming in tomorrow, or Friday, and to be able to quickly provide that content in an authentic, accessible way, fast as a team, must be really empowering, because it's very agile.
Yeah, and I think coming out of all those restrictions we've had with COVID, obviously now, we can return to some elements of learning and development that historically we've done. So face-to-face learning, which is really important, obviously, because we're, training clinicians. I'm a nurse and a nurse educator, so there's obviously parts of my job that are really important to do face-to-face. But thinking also about how the VidVersity training can still be a component of, for example, of the clinical training I do with using toolboxing and using face-to-face training, and maybe another form. So how does it form a basis of other, one of the many things that we've got in the new LMS, and with face-to-face, with webinars, with all of the tools that we have as educators. I think it's been a really great adjunct sort of tool that we have.
Yeah, and coming out of COVID, and we're going back to a bit of a new normal, I love that learning cycle of watch someone do it, have a go at doing it, but then you can have that video interactive place that you can keep dipping into as you're still learning. Because just because you've seen someone do it or done it once in a training environment doesn't mean you're ready to go. So that person can watch it as many times as they need to feel competent, and you can be keeping that sort of data. Can really help a business know where people are getting stuck, what questions they didn't get right. So the LMS can gather a lot of that data. But that learning cycle is really important, not just teach them and all the best. So you can have the follow-up material, which is fantastic. Great. Have you got any further questions, Liz?
No. So the one question I'd like to ask is, how do you feel that sort of this experience over COVID has reshaped how you'll approach learning in the future, even when there's a real normality returning, hopefully soon?
Yeah, well, absolutely. I think the biggest learning for us, and I don't think it was something that wasn't in the thought process or the wheelhouse of the L&D team here. I think we're certainly using our own people and our own services was something we'd always really aimed for here at UA, but I think we had been browbeaten by people in our organisation, particularly the IT team, saying, "Oh no, we don't use YouTube. It's unsafe, and you can't do this and you can't do that." And we really just went, "Bang, let's do it. It's off. It's not hosted by UA," and we really just beat them out of that. And now I think being able to, I think it's just changed the way our staff see training, rather than off the shelf with people that they don't recognise, and it being so formalised, to be able to see, for us to be able to create training in a couple of days that can then be reused is really radically innovates the way we create things. And so what I may have been able to develop and provide to 2 or 3 people, I can now develop and provide to multiple people and reuse in the organisation, which is, it's just really great bang for buck.
Yeah, and also I think too, you can create video but then adapt it to different audiences within your organisation with different needs, so that the questions can be tailored according to their function, but you can still use the central resource that you've captured.
And so, I guess, I sit with my nurse educator hat on, but there's other people in my team. So from an OD perspective, and then there's, when other people in our organisation have learning needs, whether it's our systems people, or whether it's it might be our quality team have a rollout, then this is also real opportunity for all of those people, and we can assist them with perhaps using this program as well, because it's they've seen it and they believe in it.
Yeah, and there's so many applications. So we've got literally 1 minute to go, because we really wanted to keep this as a half-hour session. We like to run them relatively frequently across different sectors. I'm just going to mention quickly a monthly workshop we run at VidVersity. It's run over 2 half days, and we publish the dates on our website. We might send them to everyone who's registered. And it is a practical, hands-on experience from conception of an idea of what you want to build, planning and designing, and then you actually build it and can take it into your organisation and deploy it. We don't charge for these workshops. They're over 2 half days, and we do a blend of learning. So people join on Zoom, they go off and do the self-paced modules, and then come back for help and support. So it's very interactive, it's very practical, but we really are all about having that experience of creating something, seeing how accessible it is, and then delivering it. So I just wanted to give that little quick plug before we go, because we just get fabulous feedback, and I think it's the best way to try out this kind of thing.
Get your hands dirty.
That's right.
Thank you so much, Karl. I really appreciate it. It's been I met you last March, and wow, what a year it was last year. But now you guys are all on your own, and that's the other thing. We, as a service, we can always help if people need. So at the moment you're swamped, so we're helping you out. So we can always help build stuff as well. So thank you, Karl. Thank you everyone for coming. This has been recorded, so everyone will receive the recording. And it's just thanks for if you've got any questions, pop them in the chat room. But a big part of what I'm always trying to do is, if I say half an hour, it's half an hour. So thank you so much, everyone. Have a lovely day, and if anyone's in Brisbane, please take care. Thank you.
Thanks, guys.
Bye.
See you later.
Bye.